Okay, is it me now? All right, so bienvenidos, episodio 9. Welcome. This is episode 9. All right, so this is a Crack Me Up podcast. We will not be doing much Spanish. Actually, we're going to be playing a game where we get slapped in the face by a what?
Chancla.
Chancla.
It's called a
which
chancla.
Is sandal?
Yeah, it's a sandal. This
Okay.
is every Latino's nightmare right here. Not just Latinos. I know some Asian cultures like to use it too. But yes, this is la chancla.
Okay, la chancla.
Sí.
All right, so we will get into that. Anything else we want to talk about right off the top? Once again, you don't like listening to our random stuff, you can just click off of it. Love you.
Especially you, Steve. He always be commenting on our stuff.
Oh my gosh. Wait, was that a Steve with a PH or a Steve with a V?
Hey now. That is making fun of moi. All right, so some of the stuff I want to get into right away will be on what? Brand, Target, whatever. We want to talk about chiropractic myths, like obviously you get called the quack, you get called all sorts of stuff, and, in our office we really do concentrate on a lot of neuromuscular stuff, even though chiropractic can help with things outside of that. That's just not our stick, so to speak, and so we really try to stick to knee issues, low back issues, or neck issues that cause radiating symptoms. And we also are getting more into neuropathy. That is a tough one. You got to be very, very good at diagnosing that. And then we do some general chiropractic care as well. And that's just kind of left over from, my practice in the past, where we would treat 9 bazillion people in a day. So.
Damn, guys, was it really 9 bazillion people in a day?
93 was the most.
Sometimes 9 bazillion in one.
Damn.
In one.
How are you not dead yet? How are you not broken up?
Well, I am. I just hide it very well.
It'd be like that.
Yeah, as most of us do. That is, the chiropractic myth is that the staff gets taken care of so well.
Yeah, that's not fact.
Not at all. I feel like
we're all the worst patients. We truly are. Like, we're all awful.
We're so bad.
Bad.
I mean, we'll nag everybody else because, we care about them more than our own selves like that, don't we?
Yeah, I think a lot of people do, for sure. Mm-hmm. But we're good at nagging each other. So.
Yeah, that too.
Yeah.
And we'll be like, oh, when was the last time you got adjusted? And then we'll be like, ooh, and be like, all right, you're going to get adjusted today. I'll put you on a schedule. You don't have a say in it.
This is true.
Yes, very much so.
Some of the myths that I would like to address with chiropractic is like, once you go, you always have to go. Once you start, you can't stop. And, it depends how you look at that. If you're not progressing in care, decreasing pain, increasing function in your life, you really shouldn't continue to go. You should go get, more imaging, things like that. Make sure that you're treating the correct thing. And so that's what we do in our office for sure. But there is some ongoing care. I mean, even some insurances are starting to cover some routine care. Not much, I'm just saying.
Yeah.
But they are covering some of it. So, not that insurance covering it means squat, but it just means, just like lifting, just like making sure not to continue to eat like it's the holidays, those sorts of things. You got to maintain your body, and so increase that function. And so, that's one of the chiropractic myths that kind of annoys me with people.
Yeah, it's like, oh, I went one time and you didn't fix me. Well, your injury, whatever happened over time, it didn't come from this one incident. Also, you're not going to stop doing what got you to this point, It's just like you don't change your oil one time. You don't brush your teeth one time. You'd have to continue to do those things to maintain where you're at. And
yeah, you don't take one antibiotic.
Yeah, exactly.
You have to go the full course of care.
Yeah.
Yeah. And that's why we did our spinal hygiene. You know, learn about that. You actually got to continue. You got to take care of it. It's just like anything else. Like, you're not going to stop, you know, brushing your teeth, or you're not going to stop, like, you know, getting all that care in there done. So.
Yeah, because if you do with your teeth, what does it lead to?
Cavities. Getting your teeth
gum
pulled
disease.
out.
Yeah, it's not great. So, but any other chiropractic myths that you guys would like to talk about, or you want to move on?
So is the popping you breaking my bones?
Yeah, so by the name, Crack Me Up, you can tell that I don't mind this, like when people say, crack me, doc, but, you know, some chiropractors don't like that. And I think that the reason is what you're alluding to. It sounds like you're breaking a bone or something like that, and that's not. I mean, if you are, you're going to be in pain. The periosteum will let you know that you did break something. But no, it's just a release of nitrogen or oxygen in between the joints. And so that's, you know, what that popping sound is.
Yeah, I know it makes some people nervous or they don't like it, but I always like when you get a good pop, like an audible pop. I'm like, oh, that felt good. Did you hear that?
Yeah. Some people are grossed out by it, which I get that a little bit. But
I feel like
I've gotten used to it.
Yeah, I feel like we get really excited or amazed when we hear a really loud pop. You know, when we're on the other side of the door, we can hear it. We're like, oh, did you hear that? And that was a good one.
That's awesome.
The secret behind the scenes weirdness of us.
Yeah, very much so. Very much so.
Yeah, but you probably wouldn't work here if you thought it was gross.
This is true.
Yeah. I mean, I've had multiple patients over the years where it's like, oh, that's gross, you know, which I think is so funny. But they understand the benefit of it is why they're continuing to go. So, yeah.
All right.
Yeah, that was a good one.
Mm-hmm.
I like it.
So now what to move on to, what would you guys like to see patients kind of get a sneak peek behind the scenes? Maybe it's a little annoying or that they don't know these things. Yeah.
Behind the scenes stuff.
Yeah, so like obviously one big one is, you know, insurance covers everything that we do here, right? Like that's annoying. And it's like you should see the behind the scenes of what Amber does to, you know, work hard to get this stuff covered, and then when she has to reprocess it or send it to a secondary, and you know, I'm missing 1,000 things that she has to do, and so, you know, she has to point a DX or something to a certain thing. Like it's annoying.
It is. Yeah, we've talked about that before, how unfortunately a lot of people think that their insurance card is like a magic card that's going to cover everything, or maybe because they went to, you know, a different type of provider, they think, oh, at this place I only, you know, paid a $10 copay. What do you mean it's more here? And it's like the coverage is different depending on the provider and type of care you're looking for. And sometimes they don't cover things no matter how hard, you know, we try, and it's not up to me. Unfortunately, it's up to your insurance. And in fact, when I call, insurance companies will tell me this is an insurance benefit, not an entitlement. We don't have to pay that. And then I get to be the person to deliver that to the patient, which of course then it's my fault. So that's one thing that, like, I just wish, I don't know, people would understand, or they would realize how much it really takes, you know, that I had to wait on hold for 20 minutes to get this answer or chat with somebody, and I spent like an hour to disappoint you, basically.
Yep.
And you get to deal with it too, because like I have to download to you, and then you download to a Spanish patient. And
yes, definitely. Like, obviously, I'll get those two with like patients that are like, oh, but why isn't it covering this? And it's like, you got to explain to them, like, well, it's billable, but it doesn't mean it's going to get covered. And just because they tell you,
that's the flip side.
Yeah, and you're talking to a representative. Like, a representative is going to tell you one thing next time you call, and you might get a different representative and tell you a totally complete different thing.
Yeah, and it's different on the provider side versus the member side. So, like, if you as a member call in, they only have access to a certain amount of things, versus me as a provider, I call in and I can go over a lot more with them, and they're going to give me a more detailed answer, and we'll be able to check like coding, diagnostics, if there's medical, like all the behind the scenes stuff. And like if there is any opportunity for prior authorization, what do I need to do? Or is it just something that flat out isn't cover? It might be allowable and billable, but that doesn't mean they're going to pay on it. And unfortunately, then that's when it turns into patient responsibility. But if you as a patient call in, all they're going to look at is, yes, that place is in network. It'll be XYZ. Because you're not going over everything that we would potentially be doing. And that also can get confusing for patients. So,
yeah, so it's a lot of explaining on the insurance side and a lot of confusion, a lot of not being able to understand, like, why wouldn't they cover it,
I know. I can get pretty fired up about it, as you know.
Yeah. But then we also get, like, the calls from them about patients that don't even use their insurance or, like, people that will, like, haven't been here in a while, and it's like, why do you need that?
Yeah, I don't think people understand, too, that when we submit to your insurance, we're subject to, like, random audits from insurance companies, too. So, like, we'll get medical records requests to make sure that you are coming in for something that they should have paid on. And it has happened in the past where they'll do a review and then they'll decide, well, actually, we shouldn't have paid on it. And this could be a year, or sometimes it's been 2 years later, that then they decide to recoup the money, which means maybe they paid me $20, but now they're taking that $20 back. So do you think if I call you a year or two later and I tell you, hey, they took it back, they said they shouldn't have covered it, you owe me $20, you're going to be like,
you're going to be like, why should I have to pay you? Yeah.
Yeah. Somehow, again, it's something I did. Something I did is wrong, even though it's all on their insurance company.
Yeah. Like that 1 week, you got really hit that 1 week. Gosh.
I did. Yeah. Like, sometimes life just kicks your ass, man. Yeah. But you surround yourself with good people, and they can help pull you out of it, hopefully. So that was one of those weeks.
Yeah, that was one of those weeks. They really came after you with those. Ugh. But
yeah. I don't know. Like, there's things that happen throughout the day that I don't want to say, like, it's a patient's fault, but it's kind of annoying, like, when somebody's maybe running behind and then they get here and then they got to go to the bathroom and then they want to make a coffee and then they, like, want to chat. And it's like the 30 seconds that it takes to do something can, like, get everything behind. And it's hard unless you come from, like, a scheduling world or you know that. And I feel bad saying, like, it's annoying because most of the time we can accommodate it, but it just, your, lag is going to affect the next thing, and it just kind of affects the whole schedule. But thankfully we're all in constant communication and we can be like, okay, this is what we're going to do, this is how we're going to make it work, because you don't want to make anybody that was already here or that is still due to arrive mess up their appointment and their time, in order to accommodate the person that maybe was running behind. But you also don't want to not make that your best effort to accommodate that person.
Yeah.
So thankfully we usually can make it work, but it's also like, oh, you're killing me.
And we'll see it sometimes. Like we'll have people. The one thing that really is oh, you guys are busy.
Yes.
And it's like, no, people will get here early, people will get here on time, and people will get here late, all at the same time. And it's like they're running into each other, and like you said, you gotta try to accommodate everybody, because you don't want to make this person that's already been waiting for so long to get them into a room, or like you don't want to, because this person was late, you don't want to be like, all right, well now you have to wait for your appointment time, even though it's already past it. So yes, that's one of the things, is like, you guys are so busy, and it's like, no,
I know,
that's
you
not
all
it.
showed up at the same time.
You guys all showed up at the same time. Yes.
Yeah. So I usually say, not really. Like, everything's just happening all at once, Which, again, it's not like we can make it work. And, like, I feel so bad saying it's annoying. But, it's just...
it is annoying. It's, drives me crazy that, because it does. It affects other people's experience. And that is what we're about, is making sure people have a good experience. I hear it constantly. You have the best staff. They're so awesome, like, all this stuff. And it's like, yes, because they work with you, because they do all this, like, so I don't know.
I know. It's just gotten a little out of control lately. Like, I was really sad when we had to reinstitute the no-show and cancellation policy. We've been able to, fortunately not enforce it, or maybe we should have just never, went away with it. But having to do that again kind of is like, come on, guys.
Yeah, it's kind of awkward when you tell people, like, oh, I'm going to have to charge you a late fee. Like, you've done this so many times.
Yeah,
like I get it. Sometimes you can't. Like, things happen, but it's like, come on now.
Yeah, because it boils down to you're taking the time from somebody else, and we're getting things prepared for you. And then when you don't make it, or you do a last minute cancellation like that, maybe there's somebody who we couldn't get in, and they had to wait because of that, or maybe, you know, we didn't start somebody early because we thought you were coming. Like, it just, again, it affects other people. And I think that's why, you know, we warned people for months that we were going to have to start doing that. And I felt very much like a teacher being like, you're the naughty kid in class. Like, you've ruined it for everybody type of thing. But like,
Yeah.
I mean, we have policies for a reason. And I know other businesses do, so I shouldn't feel some type of way about it. But... And we give everybody, usually, like, you get one. Like, we understand life happens and, you know.
Yeah. We give them at least, like, one thing. It's like,
you can't just be like, oh, I forgot and I went to a movie. It's Tuesday, you know, cheap movie day.
Yeah. No. Ugh, gosh. No. Like, you know you have an appointment, and instead of taking care of yourself, you're going to go watch a movie or do other stuff. Like, ugh. But I know there's other things that have annoyed Amber, like when people touch her plants.
Oh, I forgot about that. Yeah.
Guys, her plants absorbs your guys' energy. If you got bad juju energy, her plant is gonna die. We don't want that.
Well, but in all seriousness, it's not like just the juju. But it's the oils on your hands that you don't realize that you have. And you'll touch the plant, and then sometimes that leaf will die or it'll start to brown. Like you don't touch them, especially succulents. They're very particular. I always joke that they thrive on neglect because you don't touch them. You don't mess with them. Like barely water them. Like they do good because I ignore them.
Yeah.
I forgot
Don't
about that.
pet our plants is what she's saying.
Don't touch them, guys.
Back away from the plants.
You can look, just don't touch them.
Just don't touch.
Yes.
No.
That's funny.
Well, besides that, I mean, there's like other people that do things with the equipment that they probably shouldn't be doing.
I know.
Like,
I'll hear a noise and I'll look at you and be like, did they just? And you're like, yeah, they do it all the time.
yeah, it's like we get you guys want to help, but like this is expensive ass equipment. Like, if you break it, are you gonna pay for it?
Yeah.
Probably not.
Yeah. We have actually had somebody break one of the lasers. They did not pay for it, but
$17,000 later.
Yep. So it's not like it's very advanced technology. It's not cheap technology. So
Well, and that one's the cheaper one.
yeah, I know it is. But yes,
Yeah.
there's a reason why we handle it and you don't handle it. But it does always shock me how many people will just like start to take themselves off of whatever therapy or rehab they are. Like, don't do that. Just like it always shocks me when people start rearranging the chairs in the hospitality area.
Yeah.
Like, have you ever gone to an appointment and just start rearranging stuff?
Not at all. I don't know why you would do that. That's not my place.
Yeah, it's bizarre, and it's like a lot of people that will
Yeah.
do
It
that.
is.
And it's not like they're doing it in the way to like make the flow better. It's like they'll randomly grab a chair and just like pull it in a certain direction, and it's not like it's right up on another chair. Like we have individual chairs, so if it's like, oh, I don't want to sit next to somebody, the closest you're going to get to somebody is we have two chairs kind of angled, and they're maybe 2 feet apart. Like, it's just wild.
I feel like it might be the exact same space that we have in between each other. Like, it's not like directly next to someone, you know, but
Yeah.
there's space in between. Yeah. Plus, like, you can hurt yourself moving, like, getting off of the some of this equipment, like trying to do all this stuff. Like with the sticky pads, you can get burned, shocked, all that stuff. Like, you don't want that. And then who you'll be blaming? You'll probably be blaming us.
That's true. That's very true.
So don't touch your stuff, guys.
Hands off. The plants.
Hold up.
And the equipment.
Don't touch your stuff.
You gotta do it again. They didn't.
You guys didn't see it? Look at that. The chancla. You get the chancla.
We'll just keep that at the front desk.
So what's some of the other stuff that drives you crazy? Is it Dr. Google? That would probably be more up my alley. Dr. Google.
Yeah.
is-
I got to do my own
annoying.
research.
Yeah. Yeah, which their research ends up being like maybe looking at our reviews, or I don't even know where they go for some of it. But, you know, The other one's like, I feel better, so I'm going to stop coming. It's like, okay, well, good luck. Things like that. It's just like, what are you doing?
Yeah,
Come on, people.
That goes back to the, like, oh, well, I came once, it fixed me. Like, it didn't fix me. Stuff like that, so.
Yeah, one person this morning was like, I want to get back into it. But I'll call you. Like, okay. And we accommodate all sorts of different people, so it is what it is. Like, I believe healthcare is a choice. You can choose to do what you want, but you got to suffer the consequences of that. And I'm going to tell you what you need, but you can choose to do whatever you want. You know?
That's the flip side of it, though, too, is when people don't listen to you, because at the end of the day, they're still going to be mad at us. Like, we've done something wrong, like, oh, it's not working or whatever, but you also didn't come when we told you to, and you're not doing everything we told you to. But it's still our fault. Yeah. Like, that's where it gets frustrating.
When it does get put back on us, that's why we try to create all these safeguards as far as the, skipping appointment policy, like, on progress exams, asking them everything that they're doing, making sure that they're sticking to their exercises, doing their at-home care stuff. Like, we have to do that. We'd rather not, sit here and lecture you constantly and remind you that you're only doing 25% of it. But, the reality is you got to put in a little bit of work too, I wish this world was just passive and you didn't have to do anything. So,
and I mean, we see it with like patients. Like, you see patients with have similar stuff going on, and like one of them's not doing so great. Why? Because they're not doing what the things that we've told them to do. But then you see this other patient, they're doing everything that they're being told to do. They're doing their exercises, they're doing red light, they're doing the icing, they're doing all the things that we've told them to do, and they're doing great. They're doing good. So it's very important to do what you have to do. Do your red light, do your exercises.
Yeah. But then on the flip side, too, when people are not doing so good, but then they don't come in early, even though we tell them, call us if you need us. I feel like we've gotten like a wave of those recently, where it's like, well, why did you think you just needed to
wait?
Why?
I've been hurting for 3 weeks, or something like that. It's like, well, you call us 3 weeks ago.
Yeah.
Anything past 48 hours is usually a problem.
Mm-hmm. Like, we've told a lot of people, we'll tell them when they leave, like, hey, if you need in earlier, please call us. You don't have to wait until your appointment date.
Yeah, this morning I told the farm kid, I was like, so do it. Make the time to do it.
Yes.
I don't care if you think you can tough through it. Like, don't. Come in.
Yes, yeah.
The farm kid.
Yeah.
Yeah, that's funny.
Yeah, well, that's what he said. He's like, well, I'm a farm kid. And I'm like, yeah, I know, but you got to still take care of yourself or you ain't taking care of the farm.
You're not a kid anymore.
He's
Come on
not
now.
a kid.
No.
Well, yeah, that's what I mean. So when he was a kid, he was throwing hay bales, moving irrigation, doing all this stuff with cattle, blah, 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 all this stuff. And that's probably why you hurt now, you know? It's usually residual from a lot of micro trauma or one specific trauma. So, yeah. Just like knee pain. And, there's a bunch of different stuff that we can treat with knee pain. Definitely meniscus tears, like old ones, things like that. Degenerative changes, any of the 4 grading scales of osteoarthritis. And so, that's a lot of the stuff that we treat as far as our knee pain protocols. Really what it ultimately comes down to, a lot of these people can't go up and down stairs. They can't go for long walks, things like that. But, internally there's something going on, loss of cartilage, osteoarthritis, like a bunch of different stuff, increased inflammation, things like that. So, anything to add to that?
I mean, I can speak to the meniscus. I mean, that's what I had. I tore it. It healed, tore it again, had fraying in there, got some other tendons and ligaments involved and stuff. And we talked about it before, without everything you've done to help me, I'd probably be moving like I was 80 and I wouldn't be able to go on these crazy hikes on vacations and move around. I wouldn't be able to zoom around here in the clinic. every time I squat down to help a patient, I think about that, like, oh, I don't have to bring the stool over to sit down. I can squat down and do it, and it doesn't hurt me. And I feel like it makes me a little bit faster, honestly. Like, so thank you.
You're welcome. And what I think about is more long term. I think about you in 20, 30 years, like what this treatment is preventing you down the road, because, maybe it would have been 10, 15, 20 years, you would, been so far progressed that there's nothing you can do and you need a knee replacement. But, since you're preventing that and potentially healing the inside of your joint, then, you're not going to have as much degeneration later on. So, like, that is the huge benefit of that.
That's true.
You're seeing the immediate effects of it.
Yeah. A lot of times it's hard to think about that long term. And I know even some patients don't think about that too. And they're like, oh, I got to take care of myself today to be there tomorrow type of thing. Because you are focused on the immediate. But odds are I probably would be looking at a knee replacement, because we did have to end up scoping that one knee. And it, helped for maybe a little bit, but it came back. So that's probably, the route, if I didn't know about this, that I unfortunately would have went, and who knows how that would have gone, like the success rate of that.
Surgeries. Yikes.
Yeah. So if you got knee pain, let us take a look, and we will see if we can help. We can't help everybody, but we can help a lot of people.
So I see you have one thing right there of patients. So would you rather adjust 50 patients, or would you rather be with the one patient that just talks and talks and talks?
Ooh, Amber?
I would rather do 50. I love people and I love interactions. I love taking care of people. But if I was with that one patient, I just feel like it'd be very draining. And you all know that there are certain patients who just, whether or not they mean to be, or an energy suck or a time suck, and like it takes a lot out of you. And so I'd rather be there for multiple people. And also I feel like timing wise of like your day, I feel like it would feel like it went a little faster too, and you're not just with this one person, and then knowing that you're impacting more lives.
Mm-hmm.
If that patient was Amber or Ida, I would be fine with that. But outside of that, it's so hard for me to be in one confined area with one person for a long time. Like, I am wonderful, I think, with people in short spurts. Like,
yeah, I like you until I got to know you. So let's let's keep it short and sweet.
So I guess it's the opposite.
No, not you. You know what I mean.
I
You're wonderful.
Oh, okay.
You're wonderful.
In short spurts.
Well, we got the shortest spurt over here. So
this is a one-way street, I guess. I'd hang out with her, but I guess she wouldn't hang out with me.
No, you know.
Well, I would, yeah. You're if you do with the patients, you're taking care of multiple people. Each time it's going to be something different. You're going to be taking care of, a different area of their body, which is always something interesting for me. Because it's like, you're not just doing, it's repetitive, but it's not repetitive, With that one patient, it just depends. There's some times where I'm like halfway out the door and they're still talking, and I'm like, all right, I got it. I gotta go.
Mm-hmm.
But I don't
See, that's
think
why
I'd be
we
able
all
to
get
be in
along.
there.
We all said the same thing.
No. Yeah. How many times have you seen me like halfway out the door and I'm like, they're still, yeah. And I feel like they catch.
That's when I'm like,
Uh-huh.
I need a Spanish translation.
Yes. Oh my God. Yes. That's the way they get me out of there.
Yeah.
I'm like, hey, I need someone to translate.
Yeah.
Bye.
Well,
Adios.
sometimes it really is too, that, but also sometimes it's like, okay, there's other people in the building to take
That
care
need to
of.
be taken care of.
Yeah.
Mhm.
Yeah, you got to show the love to everybody.
Yeah.
So. All right, what's the next one? If you could only treat knees or backs based upon, patients' experience, all that stuff in the past, what would you do if you could only do one or the other?
When you say backs, you mean spinal decompression, right?
Yeah.
Okay.
Yeah.
I think currently I'm leaning towards decompression, spinal decompression.
I feel like it is too. Yeah. I like doing knees. Don't
Yeah.
get me wrong on that, because I feel like that's where we kind of drove off. But like with the spine, it's just so much more interesting, more complex, and like each person has something different going on, and it's affecting them all differently. So like we'll have numbness going down the leg, or like in their hands if it's from their neck. So it's like super interesting to see, or if it's just affecting one of their legs and not the other one. So it's super interesting for me to see that. And each person like progresses differently. So it's
I agree.
Sure, I would say the back.
And maybe it's because a lot of times, I don't know, they maybe take a little bit longer to respond, where with the knees, it's like usually you can get some pretty good results pretty quickly.
True.
And so I feel like with spinal decompression, maybe it's just that, I like a challenge more, and it feels more like a challenge, and it is very interesting, and there's a lot more different, avenues that we've been able to explore and different things that we've been able to do, which is very interesting to me. I love learning things, and information to me is like, give me it all. So I'm all like, yes, we could do this, like, let's do this. Plus, I also feel like I've really, not that I'm not enjoying the knee patients, but this crop of spinal decompression people that we've had recently, I really like them all. And it's been cool to see like how we're affecting them, and how it's impacting their lives. And again, the different symptoms that they have, and just, they're all a little different. Like, yes, maybe we have 3 low back decompression cases, but this person's, only feeling it in their, legs when they're sitting down, but this person can't take 2 steps without it, or maybe this person it's wrapping around to their groin, and it's like, it's been very interesting.
Yeah, for sure.
Okay, now you go.
I mean, I tend to have to agree that because we have to, it seems like, change things more, and you and I both love change.
Yes.
So I enjoy that, and you're right. It is a little bit slower progression with it usually, but I think the overall change is so much more dramatic from what they couldn't do to what they can do now. That it is very dramatic. A lot of these people are having to miss work, or can't really do anything, and so taking them from that to actually being able to do all those things, it's just awesome. I love it.
So the back, spinal.
Yeah. I mean, and not that the knee isn't, the knee is great, like real fast. Mm-hmm. They see a huge response right away. And so that's fun to see. But then, the progression of that really slows down. And so they get used to the quick progress, and then so it takes more education on the back end. On the backs, I feel like it's more education on the front end. It's like, okay, you may feel you like you're better, you may feel like you're worse, you may feel the same. That's all normal.
Mm-hmm.
Yeah. Like, you still communicate that, because we can change some things up, maybe make you a little bit more comfortable, things like that. But in the beginning, you're really having to educate these people, and I like that. So it's a challenge thing. You're right.
Yeah. I do really enjoy it. So, and we agreed again.
All right. And what else we got here? You want to play?
I do got some cards right here. It comes with the chancla. This is a TikTok shop game.
¿Cómo se dice?
Yeah, it's called Cómo se dice. So we're gonna go through these. I'm gonna ask you, how do you say this, and it'll show the picture. Obviously, you guys might not know it, but we can go over it real quick, and then we can start from there. Hopefully, you guys will remember some of them. If you don't, you guys will get la chancla. I'm sorry.
Are you gonna hit me with it?
Yeah, we'll review it. So, belly button, you say ombligo.
Ombligo.
Okay, good job.
How many are we doing here? How many we got?
We'll see.
Memorize?
Well, how many do you guys want to do? Ombligo,
pick out like 5.
How do you this one drunk?
Okay, I got this. You ready? Did you show him the card? Drunk in Spanish.
It's drunk in Spanish.
You ready? You ready? Day.
Yes.
No. Borracho.
Yes, borracho. So
Borracho.
borracho. All right, there's another one. It's funny. It's fart. You say pedo.
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 This was a good one since,
Pedo.
around the corner. Easter is Pascua.
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 Yes, Pascua.
Pascua.
Yes. Now,
How many are we doing here?
I told her she could pick 5.
Okay.
it's a library. How do you say this?
Biblioteca.
Yes.
Okay, so umbilico. No.
Ombligo.
Ombligo.
Borracho.
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 Pascua.
Pascua.
Easter. Pedo.
Pedo.
Fart.
Fart.
And then the one that
Biblioteca.
Library. Okay.
Okay.
Wait, what was it?
I'm
Just
gonna try
5?
really hard. Yeah, let's just do 5.
I'm adding this one in there.
Oh,
I'm adding the white one in there.
Okay.
I'm adding that one.
You could, if you want to pull some bingo things, I might remember some of those.
I know, right? La loteria.
Yes.
Yeah. All right, guys.
La reina.
How do you say drunk in Spanish?
Borracho.
Borracho.
Good job. Okay. How do you say Easter in Spanish?
What's right there?
Pascua.
Oh, well, sorry. Well, she said it either way. Just because it's right there doesn't mean
Wait. I said it. Does that mean he gets hit?
Ready?
Why you got to get the camera on me
Well,
first?
Well,
What are
talk
you
to your
hitting?
mic. You.
What are you going to hit, though?
Anything.
You're going to throw it at your head.
Okay, well, you guys got to be quiet so it comes to me. Okay.
This is why we didn't win at darts.
This is why. Literally not at all. Yeah,
You got me in my photo. How you say it? Ear?
Do you not remember how to say ear?
No, I never knew how to say ear.
I tried to teach you. Oreja.
Oreja?
Yeah.
Okay.
Oreja.
Boca.
Uh-huh.
I remember mouth.
How do you say belly button in Spanish? ¿Cómo se dice?
Ombligo.
God damn it.
I couldn't remember. I wanted to say the umbilical thing or whatever.
How do you say library in Spanish?
Biblioteca.
Amber.
Do I gotta hit myself?
How do you say pe?
Fart. That's how you say pedo.
Yeah.
Pero.
I distracted you when I hit
Yes,
myself.
you did. All right. We didn't do this one. How do you say left in Spanish?
I don't know.
Starts
Yep.
with an E. I didn't.
Izquierda.
Izquierda. I was like, I didn't see
Izquierda.
it.
Izquierda. So this is this one right here is you can use the chancla on anyone. You have the chancla, so you can throw it at anyone.
Chancla.
Chancla? La chancla?
Yes, you can throw the chancla.
Throw it at the maestro. Maestra. Sorry.
Ah, really? Oh, you might know this one. How do you say ankle?
Ankle? I don't know that one.
Tobillo?
Tobillo? No.
I feel like you. God damn, man. Okay. Do you remember this one, Amber?
Rodilla.
How do you say umbrella?
Oh, you even just told me and I forgot. I don't remember it.
Paraguas. Remember, it's in the
the-
loteria.
yes.
Yes, it's in the loteria. Paraguas.
The aguas is in there.
Paraguas.
Do you remember this one? How do you say
Oh, bacon.
Bacon.
Tocino?
Yes!
Oh,
Hey!
bacon!
She got it.
Tocino?
Tocino. Okay, you might know this one. How do you say 70 in Spanish?
Ooh, I don't know that I can get that right off. Hey now.
Okay, so siete is 7. So is it a version of siete?
It is.
Sienta? No. Am I close?
Say it again?
I said sienta.
No.
No. Si.
Siete seis. Yeah, I don't know.
You fucking told me to.
I'm more disappointed in him, honestly, because he was doing his numbers.
I'm just trying to like logic my way through this and.
Oh!
that was
I
good.
God it!
Yeah.
You didn't get it on
God
camera.
dang it!
though.
We missed it! 70.
Right in the cabeza.
70.
Yes! See, she got that one.
90.
How do you say clown in Spanish?
Mm-hmm.
Starts with a P, right?
Uh-huh.
Pierna. Which is like...
I don't remember. Pie.
No, I don't.
Payaso.
Payaso. I got
Payaso.
pie.
Payaso.
Payaso.
Payaso. No te comportes como un payaso. Don't act like a clown.
What she said.
Ooh, an avocado.
An avocado. How do you say it in Spanish? Kind of the same. Oh,
Avocados
similar.
from Mexico.
Ooh.
Is it Giat?
No.
No, but it ends in like cato.
Yeah.
Yeah.
Mr. Roboto?
Aquato? No, that's not.
Close.
That's all wrong.
Aguacate.
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 Yeah, aguacate.
I love me some avocado.
All right. Good job,
Yeah,
guys.
I forgot all of those already.
Not surprised. It's okay. We are.
Biblioteca.
Yeah. How do you say bacon?
Tocino.
Yeah. How do you say drunk?
Borracho.
There you go.
Or Ide is an acceptable answer.
That one is that
That one's funny.
That was good. I should bring the loteria instead because
Yeah. That was really
you
fun.
would kill that one. You would very much kill that one.
Should I try the body parts that I remember?
What are the body parts that you remember?
Cabeza is head.
Cabeza?
Cabeza.
You said cabeza.
Okay. Cabeza. Cuello, neck. Hombros, shoulders. Brazos, arms. Manos, hands. Boca, mouth. Pia, feet. Is that correct or no?
Pie.
Pie. Rodilla, knee. Pierna, leg. Espalda.
Culo!
Culo.
Culo.
That's your booty.
That's culo.
Ass. Booty.
Okay.
Yeah.
And then
Just trying to help.
Yeah.
And then I know another one, but I'm drawing a blank.
That's my fault.
Hey,
I'm sorry. I
That's still
interrupted
pretty
it.
good, though. That's still pretty good. But, I mean, we're wearing some stuff that came back to us from overseas, courtesy of Amanda, who's back. And so, she got us these cute little earrings. She got me some cherry blossom ones. And then,
I got some like origami paper cranes.
yeah. And she also got these cool socks. Look
I
at
know.
these.
Can you see my Bigfoot? It's a little kitty with the like squid head.
If you guys got a foot thing, this is your time to shine, dude.
Jeez.
Oh wow. La chancla.
He has it. So thank you, Amanda, for bringing that back from Japan.
Yes.
Sounds like her trip went really well.
I know. I'm glad to have her back. Everybody was interested in it too. It was really cute. All the Spanish speaking patients,
Yes!
they would want to ask about it. So if you two were in the area, they'd be like, wait, ask her this. And did she
Yes.
do this?
Like yesterday, we had someone towards the end of the day, and they were like, "How was her trip?" And she was there, and I'm like, "Hey, he wants to know how your trip was." And she was like, "Oh yes." And so he was like very much super interested in like hearing it, but hearing it from me and her that how her trip went and stuff. So he was very excited
cute.
to hear that. Yeah.
It was really cute.
Yeah, there was a couple of other people that were like, "Oh, you're back." There were Spanish speakers that were like asking me stuff about her trip, and they were like super interested in it. So it was cute.
It was cute. My, I think, favorite moment, as much as I love that he was asking about it, is because you were translating for both of them. Then when you went to start him, you're like, okay, let me know when you get to there. You're like, wait a minute. I need to speak Spanish to you. It's just because you were just so back and forth with both of them.
I went, because on the matrix, you go up on the frequency up to their tolerance level. So I went up to his tolerance level, and I was translating both English and Spanish. And then right when it was the halfway mark, the hit minute mark, where we go back up on the frequency, because some people don't feel it afterwards, instead of asking, ¿Quieres que le suba más? I was like, so do you want me to go higher on this? And I like stopped for a minute, and I'm like, did you just ask in English?
Yeah.
Spanish.
It was funny. He was cracking up, but he was dying.
Yeah,
too.
he was dying. It was so funny.
But you were multitasking a lot. You were translating conversations and also doing that. So
it was
just,
so funny, though.
Yeah.
Weird. She was doing everything.
Yeah, she was doing everything.
I don't know what you guys are talking about, but it was good, though. It was fun. Do you want some of these pickles?
I think Dr. K does. We were saving them for him because pickles are his favorite.
They're sour, too. You like sour stuff, right?
Are they all pickle flavored? Or is it like the pickle roulette?
That
like
one's pickle roulette.
Oh.
This one's just...
Yeah, I don't care. I'm sure it sucks.
You don't know that. You can't say that before you taste it, right?
Sour pickles?
The patient that got us the Bean Boozled thing came in today and asked about it, and also agreed that you both are little bitches, bunch of pussies, because you had spit out your stuff.
I know, we are.
Yeah. Did she tease you about it?
I ate most of it. No.
Yeah. Oh.
I think I spit out 2.
Yeah, I didn't spit out any. That was the moral of the story, was I won the game.
You win.
I do win. And you win because you get to be around me.
I'll take it. I'll take that win. Are you going to eat it and pass it, or are you just going to eat it?
I'm just eating it. They're pretty good.
Oh, there's 2 different colors. What's the difference? Oh, they're vegan. That's great.
Like, it tastes pickly, but it kind of tastes like green apple-y, too, at the same time.
Oh, interesting.
Why is there different colors?
Maybe you got a bad one. Oh, no, there's multiple.
There's multiple?
Yeah. See the color of mine?
But is it pickly?
Is it pickle and green apple?
Yeah, it's totally pickly.
Those smell sour AF.
They're
like
a
my
little
nose,
sour.
like-
Yeah.
They're not that sour.
For me, they were.
I don't know. You want to taste this one?
I ate the other one. I ate all of it.
I know. I just want to see if it's any different. You're not eating any? Is it because of the sour? Oh, okay.
Do you ever get that when you have something sour? Like it does that weird thing where it feels like your jaw is locking or something?
If it's super sour.
Yeah.
I feel like right here.
Yeah, it's like, I guess I'm a little
Is there a difference?
No, it'll happen to me too.
They
feel
taste
like
the
it's
same?
This one right. No, I haven't even tasted it.
Nice.
We're gonna do some ASMR, guys. See, the green one was more pickly than this one.
I don't know that I agree. I think it's less pickly.
Or does it taste less pickly because you had the first one?
Could be.
Oh.
And you're like, oh, this isn't...
Because
this
we're
is-
both saying that, right?
Like, yeah.
That
But,
could be true.
The
I like
green
this
one-
better.
okay, but are you choosing on just one side of your mouth, or are you choosing on both sides?
Now I'm doing both.
Okay. Because I did the green one on my right side. I'm doing this one on my left side. So I can kind of tell the difference in flavors.
So you're saying you're more accurate than me, is what you're getting
Yes,
at?
I am. Your taste buds are old, dude.
They are just refined. Come on.
Nice.
Apparently not.
Apparently not. How not?
You still go to Chipotle's?
I do.
All right. That answers that question then.
All right. What do you eat?
Food.
Like what?
I ate a torta yesterday.
A torta?
It was pretty good. It was it. So, yeah.
Nice.
Better than Chipotle's. In my experience, anyways.
Yeah. Debatable. Some tortas are really, really good. But yeah, the last one I had, I probably won't be eating a torta for a while.
Damn, that's sad.
Didn't you get a concession torta? No.
That was an elote that he got. Yeah.
Yeah.
Speaking
An
of shit,
elote
we
is
should go get an
street
elote.
They called it loca elote.
Okay.
Crazy street corn. So, it was very, very good. Put some Valentina on it. Made it a little extra spicy.
You said that the girl didn't think that you knew what Valentina was?
Yeah. So she told me it was like a hot sauce. And then she goes, Valentina. I'm like, yeah, I know what that is. I steal it from Ide all the time.
She probably gave you a crazy ass look. Like, this dude knows what that is.
Yeah. I stole it from you today. You didn't even know that. Admitting things on air.
Now we got the evidence, Ide.
Right? It's just like when he said, I like to be told what to do. And then he's like, actually, I don't like being told what to do.
Get out of my life.
But
Shoo. Don't bother me.
anything else we need to talk about?
I don't think so. I don't know. What's coming up this weekend or week or whatever. I just got soccer and Easter, I guess, is this week. So, weekend.
Do you still do like a Easter egg hunt for the kids?
No.
I mean, I know they're older, but
Yeah, no.
no.
Damn.
They're not
Yeah.
into it?
No. Do you do Easter egg hunt?
Yeah. No, I don't really.
Okay. Do you do an Easter egg
we
hunt?
talked about adult Easter egg hunts. Not that
Yeah.
you do that for the kids, but
We kind of do.
Okay.
Yeah.
What do you do?
So we do, candy and the eggs, but then we do money in there too, and then we shooters for the older ones.
Yeah.
Yeah. But we make sure.
Borracho. Ide.
Well, it's borracha since it's female, but yes.
Oh, sorry.
But yes,
es
it's
borracha.
same thing. Now, right now, guys, I'm drinking
Ide
water.
es muy borracha.
I'm just drinking water, guys. It's not liquor. Don't worry. If it was liquor, I'd have it in a red silo cup. If you know, you know.
wait, did you say silo or solo?
Solos. Is it silo or solo?
It's solo.
Solo.
But you said silo.
Did
I heard silo.
Yeah.
Don't
even say English is my second language.
Can I even use that as an excuse around you guys anymore? I'll still use it or
Yeah, you gotta use it.
Yeah, keep using
But
it.
yes, I just gotta keep them in solo cup so people don't know I'm drinking.
Yes.
That's funny.
But the fuck was I talking about? Oh yeah, Easter. So
Easter egg hunt.
we'll
Shooter.
do that. Yes. Eggs out, and then we'll let the younger ones go, and then middle age, and then the older kids will go. I have seen recently there's a trend where they'll put candy and money on someone's person taped onto them, and then the person will get a couple seconds head start, and then the kids will start chasing them.
Oh, it's like you gotta tackle them?
Yeah, you got to tackle them to get
Ooh,
all that
I like
stuff
the
out
sound
it.
of that.
Yeah.
Yeah.
Yeah, for sure. Kids that love that shit. Hey, it keeps them running and it keeps them, energy
Moving.
moving. Yep.
I really like that.
Then at the end of the day, they'll pass the fuck out.
So I guess it was April Fool's a couple days ago. Did anybody get fooled?
No.
No?
No.
Maybe.
Did anybody hear about a cool April Fool's that got pulled?
I mean, we had a patient who said that his workers try to mess with him, but he's like, I've been here too long. I didn't fall for any of it. A couple people, quit. I was about to pull that with you, but I didn't know how well that would be received, or if you would think I was serious. Had a whole resignation letter typed up and everything.
Yeah. I remember you told me that.
Yeah.
No, but no. Did your kids do anything
No,
to anybody? No.
no. It was a pretty boring year. You should have done that.
Mess with you?
Yeah.
Okay. I'll tell you I'm quitting. Give me a little bit of time.
Well, around April Fool's.
Yeah.
I won't really accept it any other time.
No.
What?
Yeah, I think it was.
Someone in the morning did tell me I thought it was the cutest little prank, but it created a lot of work for him. Kiddos' lunches got switched. They thought it was cute to April Fool's him into switching their lunches, but they go to different schools. So he was like, now I got to go get the ones to take it to the others. And I thought it was really cute, but it created a lot of work for him. But they just thought it was like the most innocent prank. And I don't know if they have like, I'm assuming different dietary needs or restrictions or something. And that's why he had to like go switch them. But so he's like, now I got to go do that. But it was like his 10-year-old, and I can't remember how old, maybe like a 7-year-old or something. So they're like,
That's too bad.
That's so cute, though.
Yeah.
Especially since they're that age. I think that's cute.
Yeah.
Oh, no. No, there was nothing else.
I know. I literally kept waiting. I'm like, okay, I work with some jokesters. Somebody's about to do something to me. Like, I'm going to get some kind of prank or patients, because they do mess with us. They'll be like, hit their button or like the call button or like be like, like just to mess with us. Yeah. But nobody did it. Yeah.
There was a week year, wasn't it?
Yeah.
Not gonna lie, I forgot it was fucking April Fool's Day.
I mean, I remember making a joke
forgot.
like, is this a prank? Is this an April Fool's prank right now? But like, that wasn't, yeah.
No, dude, like, I forgot
Must
it was
not have
April
been a
Fool's.
prank.
Yeah.
We'll leave it at that.
Yeah, but no, nobody did. No.
It's kind of lame. Dang.
Yeah, we are lame.
We are, yeah.
We really, really should have done one.
I know.
But,
You know what? It was Amanda's first day back from Japan. She was still jet lagged, so
I guess it was.
I wonder if like that's
That
where our
had to
head
play
was
a
at.
role.
Yeah, we weren't thinking about like the date, because usually we're pretty good about getting each other. Yeah.
Uh-huh.
Is there like a crazy like I'm gonna shove cake in your face tradition around
For-
April Fools?
No, unfortunately. Is it during this time? There's this one where, there is a specific part of Mexico or country? Guys, help me out here. Let me know in the comments. But I remember there was a time where they, like, don't shower for a period of time. Or, like...
I don't like that.
Or,
That's cuchichero.
yeah, but like I don't remember if it's that or because I remember when I was working at CC's with my dad, and it was I think around this time. We literally would like spray water, like we sprayed anybody down. But I don't remember if it was around this time and if it was for Easter or not, or if it was like April Fool's type thing. Yeah, I'll have to ask my dad about it because I can't remember what it was for.
We just throw cold water on each other.
Yeah,
like
basically
in
grab the bucket and
bath or shower. Yeah.
that shit was hilarious though. I loved doing that shit. Yeah, made a mess.
That laugh. That's how you know she's good at
Exactly.
pranking. Yeah. I really was ready for it.
It was lame. I was like earlier in the year. I was like, okay, what am I doing for April Fool's Day? How the fuck am I gonna do this? And there were a couple of things I had thought about, and I'm like,
What were they so we can prepare for them in the future?
If this happens, we know it's not real.
I don't want to tell you guys.
Dang.
That's the whole part of the thing. You guys gotta make it believable.
I know. I could have
People
got
get-
it out of you. I just...
They get real elaborate with it.
They do.
Yeah.
Yeah.
They get real elaborate.
Yes, they do.
There was some that one pattern. Yeah.
If you would have remembered, would you have pranked us, and what would you have done?
I wouldn't have pranked you. That sounded like a lot of work. Well, we were just getting ready for a lot of stuff like that we had coming up.
That's
like
true.
you saw, I know you were working hard. You saw how hard I was working, and I just, consumed by work.
Yeah, that's
So
true.
I am still behind.
Yeah.
I want to
Forever.
get off of this podcast so I can try to go create the Spanish landing page, but it is what it is. It'll get done eventually. So at least I'm sending, the ads to the right website now.
Good. And now you have learned from your mistake and you know what not to do.
Well, I'm wondering how often I've done that in the past and didn't realize it.
Probably never.
Sure.
All right. Well, let's get Dr. K some time so he can get off the pod.
Well, I got to take
and he can
Oliver
go get
to his
some stuff
soccer.
doing. Well,
Anyways,
that too. So join us again next week for another episode of the Crack Me Up Pod. And you guys have a good Easter. Feliz Dia de Pascua. Go hunt some eggs. Go get drunk. I don't know what the fuck you guys do. But yeah, have a good weekend.
Adios. Bye.